our project was on the Mediterranean diet and the low-carb diet. The Mediterranean diet is plant-based. It's high in fat, high in unsaturated fats, high in vegetables, fruits, whole grains, beans, nuts, and seeds, and olive oil is a big one in this diet. It is commonly associated with non-communicable diseases and total mortality, and it started growing in areas around the 1950s in areas such as Crete, Greece, and southern Italy. So the main features of the Mediterranean diet is a high fat intake, and that comes from the nuts and the oils, high consumption of low glycemic indexes, such as whole grains, nuts, fruits, vegetables. You want to have a moderate to high fish consumption, small amounts of poultry and dairy products, low consumption of red meat and any meat products, and then moderate intake of alcohol such as red wine with dinner. And this is all proven to reduce the rate of CVD and has favorable effects on numerous CVD risk factors. So the study that I chose for the Mediterranean diet was the role of Mediterranean diet on weight loss and obesity-related diseases. The participants, there were 7,447 participants that were older age, and they had a high CVD risk, but had no CVD at the time of enrollment. So this study consisted of 3 groups. The first one being the med diet with extra virgin olive oil, and then the second one was med diet with mixed nuts, and then the third one was the control diet, which was mostly low fat. So the med diet was high in fat, high in saturated, plant-based in content. There was persuasive epidemiologic and clinical trial evidence about this. The extra virgin olive oil and nuts were provided for free, doses of 1 liter per week, for use in the kitchen and at the table, and it was recommended to consume about 4 tablespoons a day, and then 30 grams of nuts were provided, such as walnuts, almonds, and hazelnuts. The effects that the study had was that majority of the participants that participated in this were overweight, and 50% of them were obese. 42% of the daily energy fat content in 2 med diets, so the first 2, and then 37% for the control diet. And then they did a follow-up in about 5 years, and the first diet, the med diet with extra virgin olive oil, resulted in weight loss and decreased waist circumference. And the big thing about this study is that little changes in body weight and less gain in central adiposity were the main things that were provided from this diet, and it helps to not promote added adiposity. This study was supported by PREDIMED, and they said that it provides sobering evidence of the potential of the med diet for weight control. This graph here is pulled from that study, and it just shows you the different diets and their overall weight that they lost throughout those almost 5 years. We noticed while we were looking for studies that the Mediterranean diet was common around all the ages, from children and in older adults. In older ages, it was beneficial for preventing heart disease, lowering cholesterol, lowering your blood pressure, and it can reduce CVD risk by lessening the impact of the mechanisms that cause it, such as hypertension, blood lipid levels, and so on. And then in preschool children, when giving them homemade lunches instead of eating lunch at their school, they scored better in their nutrition categories and their physical activity and body comp. And it shows and teaches the kids at a young age and promotes family involvement.
The Med Diet 4.0 meta-analysis found 4 pillars of sustainability in health, in the environment, in economy, and culture. It relies on buying regularly with small amounts of food from local sources, supporting farmers that often have a greater, more local variety of indigenous plants, which increases the biodiversity and promotes local spending, boosting the economy. It also puts a great value on culture and family involvement in making meals and drawing people closer together. Multiple studies over the past few decades have repeated that this diet lowers the risk of cardiovascular disease and its complications, as well as complications related to increased BMI and obesity. It's also been shown to benefit our digestion and how we process and absorb the nutrients that we're eating, leading to other health benefits that we otherwise might not attribute to our diets. However, while we know a lot about the effects of the Mediterranean diet on cardiovascular disease and obesity, there are not many studies that can confirm direct health benefits in relation to other chronic diseases. We can simply make recommendations and generalizations based on what we know from a standard population and apply it to any given disease. We also know that while this diet gives the best effects when followed in its entirety, health benefits can be seen even without strict adherence to any one of the diet's components.
When it comes to low-carb dieting, this essentially means that you want to limit foods that are high in carbohydrates, and typically you end up substituting for foods that are going to be higher in proteins and fats. Low-carb dieting aims for around 100 to 150 grams per day to be considered low-carb, and studies suggest that low-carb dieting can lead to lower triglyceride levels, it can increase HDL levels, and low-carb dieting is going to be especially beneficial to those of the obese and diabetic population. Because low-carb dieting allows for lower insulin levels, and lowering insulin levels is going to cause the body to burn stored fat for energy, which is going to allow for initiating weight loss. In this trial, a low carbohydrate ketogenic diet versus a low fat diet to treat obesity and hyperlipidemia. This is going to be a randomized control trial with 120 overweight hyperlipidemic volunteers. The objective of this study was to compare the effects of low carbohydrate ketogenic diet program with those of a low fat, low cholesterol, reduced calorie diet. Measurements of this study were body weight, body composition, fasting serum lipid levels, and tolerability. The results ended up that a greater proportion of the low carbohydrate diet group actually completed the study versus the low fat diet group. So this was 76% of the low carbohydrate diet group completed it versus 57% of the low fat group. And the low carb group also experienced greater weight loss. This next study is a meta-analysis. This is the dietary intervention for overweight and obese adults, comparison of low carbohydrate and low fat diets, meta-analysis. So the background for this study, the researchers noted that the recommendations for overweight and obese individuals is typically a reduced calorie, low fat diet, but research suggests that low carbohydrate dieting could actually be more effective. So the purpose of this study was to compare the effects of low carbohydrate versus low fat diets on weight and atherosclerotic cardiovascular disease risk in overweight and obese patients. The results of this study found that low carbohydrate dieting was significantly more favorable in affecting the secondary outcomes of changes in HDL-C and triglyceride levels, while the low fat diet was actually more favorable in affecting the total cholesterol and LDL-C levels. So the conclusion of this essentially is that low carbohydrate dieting should be considered for weight loss, but the long-term effects require a little bit more investigation. So the evidence that supports the efficacy of our topic, when compared to low-fat dieting, low-carbohydrate dieting shows a higher weight loss overall, especially in fat mass versus fat-free mass. It's shown to be effective for those with obesity and type 2 diabetes by allowing lower insulin levels, which allows for a decrease in insulin resistance, which allows for weight loss because insulin essentially stores body fat. And it also allows for an increase in HDL levels. and a decrease in serum triglyceride levels. Other benefits of low-carb dieting include lowering the risk of poor sleep quality, lowering anxiety and depression, and it also has benefits for heart health. So we also have some evidence based for the lack of support for the efficacy of the topic. When it comes to low-carb dieting, some participants in studies that we discussed earlier noted some adverse side effects, such as headache, muscle cramps, and nausea. In particular, one 53-year-old man in the low-carbohydrate diet group who had a history of early heart disease in his family actually ended up developing chest pain near the end of the study, and coronary heart disease was subsequently diagnosed. So older populations could be subject to experiencing chest pain. And longer-term studies suggest that low-carb dieting does not achieve greater weight loss overall when compared to other dieting.
So to review, the Mediterranean diet can help lower the risk of cardiovascular disease and its triggers. It can help maintain a healthy BMI and lessen the risk of obesity and its related diseases. It can improve digestion, boost the immune system, and has been shown to be versatile across any age range. Meanwhile, low-carb, high-fat diets may increase the risk of heart disease when done improperly and has a higher likelihood of unpleasant side effects. Both of these diets are about quality over quantity, and low carb can have faster initial weight loss than a lot of other diets.
In conclusion, when comparing the two diets, the Mediterranean and the low-carb diets, we see that they are both similar in the higher fat content rather than carbs. So the fat is replacing the carbs, and for Mediterranean, it's beneficial because it covers all of the food groups and helps to lower risk for heart disease. For low carb, it's beneficial to the obese and diabetic population, which is also associated with lowering insulin levels. In the Mediterranean diet, it's high vegetable and high fruit intake, and it is a limited intake of red meat. Most protein comes from your seafood or your fish. And in low carb, it accounts for greater weight loss, and longer studies suggest further recommendations that are needed to determine the effects on the long-term weight loss.